Kenya is now close to achieving epidemic control, having met the 95-95-95 global targets. 95% of people know their HIV status in Kenya. 102% of those diagnosed are receiving treatment, and 97% of those on treatment have achieved viral suppression. Despite a 65% reduction in AIDS-related deaths since 2013, the incidence rate remained at 0.39% per 1,000 people in 2023, with the majority of new infections occurring among those under 34 years. The HIV/AIDS epidemic continues to disproportionately affect vulnerable groups, including women, girls, adolescents, and key populations exacerbated by healthcare inequalities, stigma, and discrimination. This intersection of adversities highlight the urgency of scaling up multilateral interventions to address the compounded vulnerabilities faced by these groups. We are at a critical juncture where traditional strategies are insufficient to keep our goals of ending AIDS by 2030. While past approaches were rooted in healthcare, they often overlook broader drivers of infection, such as social and economic disparities, poverty, illiteracy, and environmental factors. Our theme calls for coordinated, inclusive, and multi-sectoral approaches to ensure universal access to prevention, treatment, and care. It also urges us to re-energize our efforts, from strengthening global partnerships and securing sustainable financing, to promoting equity and human rights, leveraging innovation, and building resilient health systems. Kenya has historically relied on bilateral and multilateral aid to fund its annual HIV aid budget, which stands at Kenya shilling 24.5 billion. However, with declining external funding, it is imperative that we develop robust mechanisms to make our HIV response funding more predictable and more efficient. To this end, Kenya is implementing a financing transition roadmap that focuses on governance, stewardship, domestic resource mobilization, program efficiency, and sector-wide integration. This roadmap aims to align HIV strategies with national healthcare and economic plans while enhancing accountability. Additionally, Kenya has committed to implementing universal healthcare coverage, which includes a comprehensive overhaul of the national healthcare system. This program aims to protect citizens from health vulnerabilities during crisis by prioritizing equitable access to healthcare services and integrating HIV services into the broader health and social protection frameworks. I firmly believe that the many vulnerable lessons from our national HIV and AIDS response can guide us in renewing our partnerships and securing the political support essential for the success of multilateral institutions. This event offers us, all of us, a platform to recommit to partnership and collective action on a global scale, ensuring that HIV never again poses a threat to our people, communities, or our globe.